Tens of thousands of teachers have multiple medical conditions that are considered risks for COVID-19. Since the reopening of schools 2 weeks ago, more than 130,000 teachers took part in a national survey to determine prevalence of COVID-19 associated risk factors. It revealed that more than 65,000 teachers reported having a single comorbidity, such as hypertension, asthma and diabetes. The rest have multiple medical conditions. The survey was a self-administered online questionnaire sent to all educators belonging to the various teachers' unions. Since the reopening, several schools have had to close after teachers or pupils tested positive for COVID-19. Let's discuss this with NAPTOSA Executive Director Basil Manuel, who joins us via Skype. Good evening. And with SATU Secretary General Mokoena Maluleke. He's on the line with us. Thank you, gentlemen, both for your time this evening. So, Mr. Maluleke, I'm going to start off with you. Can you give us an indication how many members of SATU have responded, or do you have overarching figures showing the number of teachers who form part of your union who might have some of these comorbidities?
Good evening, and thank you for having us indeed. Out of this particular survey that we have done, we were able to get about 89,000 of our members responding, indicating that they may be having one or two morbidities. And therefore, in terms of the percentage around that, then it was correlating exactly with what is happening in the country in terms of these types of comorbidity. When you're looking at the issues of asthma, when you're looking at the issues of hypertension and many others, especially those that are stress-related condition, they were correlating exactly with what basically we find in the country in terms of the statistics that we have from the Statistics South Africa, but also is confirmed by the Department of Health.
Okay. And Mr. Manuel, I'm going to come to you now. So today you held a webinar with Professor Shabir Mahdi and you discussed some of the findings of this survey. And the aim of this webinar was to deepen the confidence of educators in leading the reopening of schools in the wake of school closures due to COVID-19. So some of the information coming out of this survey about the prevalence of comorbidities among teachers across the country is quite worrying. Are you able to go back to your members and reassure them about their safety going back to work?
Absolutely. Simply because knowledge is power. And if people know where the latent dangers are, then they are able to deal with it. For example, as my colleague Maluleke has already indicated, hypertension, approximately 25% of teachers have shown that they have hypertension. But serious hypertension, where it is a genuine risk if you contract COVID-19, is only at 5.3%. So it shows that whilst there's a relatively high hypertensive grouping, the very serious hypertensive grouping is low. Now, if you know that, and if you know that your risk level is much lower if you simply just have it as opposed to having it seriously, you can then mitigate against it and you can start being a little more careful. And that is what this was about. It's about the science, and it's about demystifying the science so that we don't look at every little article we read and start panicking. Our teachers are under enough stress as it is.
Absolutely. Coming back to you, Mr. Maluleke. So very important, looking at the science and relying on that to guide us. What are you taking back? What message are you giving to your teachers to help keep them safe?
The message we're taking to our teachers, as my colleague Basil said, that knowledge is power. Basically, it is that we need to be able to live with the knowledge that the virus is going to be with us for a longer period. That's one. And the fact that that is going to be a reality, we have got to be able to really reconnect with ourselves and then say we cannot prisoners of fear and therefore and not believe everything that we see, because there's fake news, there's misinformation. So some people are calling it infodemic, because now we're dealing with the pandemic. and so forth. So what we're taking to our members is that you have got to arm yourself with information. You've got to educate yourself so that you are then able to be emotionally strong and mentally ready to be able to create an environment for the learners as well to be stronger, so that you anchor them on the belief that, yes, we will be able to go through this particular phase. That is what we were able to take from the series of seminars that we have around the science and so forth. It is clear that we've got to live with the virus. It's just like any other virus that we have lived with it. This one is scary. People are afraid. However, if they have knowledge and they have information which is correct, we believe that facts are important for us to deal with it.
All right. Coming back, last question for you, Mr. Manuel. So this information was broken down into quite sort of bite-sized provincial breakdowns of where people have different risk factors, co-morbidities, where there are perhaps teachers who are currently pregnant. So will this information be able to help both unions and the Department of Education in terms of determining where greater risks lie to sort of channel more resources to those areas?
Absolutely. And the first resource is education, because we, for example, discovered that the Western Cape and the Northern Cape have the highest incidence of smokers in education. And that is where we would need to target certain health issues. But of course, in various provinces, they showed different things. And as Maluleka said, they correlate exactly with what we know already from some of the other research. But this is for the department as well as for the teacher unions. For the teacher unions, it helps us with our own programs. For the department, it gives a very clear insight into the problem lying ahead, insofar as staffing is concerned, insofar as future leave is concerned, and things like that. So it covers both of us. And now we need to put our heads together to say, what is the best method that we can use to try and assist our teachers, not only with better and healthy living, but also to live with the conditions that they have, and how to ensure that the conditions don't become crippling. So it's an important study. It certainly adds on to the knowledge base we already have, and hopefully it helps us on the road ahead.
Right, thank you very much to both of you. From SATU, the Secretary General there, we've been speaking to Mogoena Maluleke, and from NAPTOSA, the Executive Director there, Basil Manuel. And certainly the science at the moment pointing to the fact that reopening of schools and schools staying open is the best possible outcome for both children and teachers.